Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about the 60-day blueprint to launch a profitable orthodontic practice in your de novo pediatric dental practice. So, it could be an existing pediatric dental practice as well, but even better if it's de novo because these patients are just coming in and they don't know anything better, right? It's a little different when you've always done things one way and then you like, oh, guess what? We're adding ortho screenings now. Now we offer orthodontics. And a lot of times parents get a little suspicious, but when you've always had it, they don't know that this is something new, you know? So when you've always had it, this is just part of what you do. This is just, and if you're not familiar with the American Dental Association standard of care towards treating kids and airway, or AAPD's recommendations for screening for orthodontics and airway, you should go do a deep dive. Search ChatGPT or Google, put comma scholar in there so you get the links and you get the literature as well and read about what they recommend. But yeah, it's your job. If you're a pediatric dentist, you have to screen these kiddos. You have to make sure they get what they need. If you're not offering it, you got to make sure you refer to someone else that does. And if they're not going, you have to be a little bit more persistent. It's not just like, oops, I referred them and then you forget about it. No, every single visit, every single 6 months, you have to bring up that conversation again. So at some point, you might as well just start offering it, because if for some reason your orthodontist that you're referring to are not managing to do what's necessary on these patients that actually need it, are 100% going to get it at age 7? No. Occasionally you're going to have one parent that doesn't get it, or you're going to have someone that just literally lost their job, but they're going to do it next year. But if it's being explained properly, your conversion rate should be 80, 90 to 100%, not 10%, not 20%. So whether it's your conversion rate or your referral rate and starting rate. And also, if your orthodontists aren't giving you a report with every single patient, they're not telling you what they're doing, why they're doing it. If you're referring for airway and not sending supplemental information, well, they're probably not thinking it's that important. It's just like, I checked a box, referring for airway. If they don't think you care, then they don't care. I'm telling you what has been discussed at AAOs that I've been to. Not necessarily, some of it's lectures, but mostly just like, I hear it in the exhibit hall, I hear it in the bathroom, I hear it in lectures. Maybe not the speakers talking about, but other people talking about it. People aren't dumb enough to have the speaker talk about that, they get sued. But legit, what's happening is the orthodontists know how easy orthodontics is getting. Not all of it's easy. There's a lot of really hard orthodontics out there. But with AI and everything out there and all these tools and indirect bonding and clear aligner, treatment plans and virtual everything, and the fact that assistants in most states can do most of the work, you are crazy if you think it's hard, because it's not. Once you figure it out, and this is just a matter of pattern recognition, and I realize that I am definitely like top 1/2 of 1% or even more than in terms of pattern recognition. After 24, 25 years of seeing so many faces over time, I know exactly what's going to happen to that kid if you don't do treatment this month, this year, next year. I know how their face is going to grow. I know what's going on. But you have to understand everything from the nasal airway to the pharyngeal airway to growth to genetics. There's a lot of components you have to understand. And it's not something you're going to get immediately. And you're not going to get this in a course. That's the interesting part. Courses are junk. They are teaching you a blueprint that does not work for every single patient. It might work for some patients, but it's going to botch a lot of patients. You have to do one-on-one. You have to learn orthodontics like you do in an orthodontic residency. We don't take any orthodontic courses in the residency. I think I took a stats course and I took a wire bending course, and that was it. And there's a few courses we had to take to get our master's, but it had nothing to do with orthodontics. We learned in our case conferences, and we learned one-on-one with preceptors and with older residents. That's how we learned. It's just repetition and doing, and eventually you will get it, and it's not rocket science. So, not hard to do in a pediatric dental practice. Just buy a freaking iTero. And you guys, like I've told you 100 times, if this changes, I will let you know. But at the moment, that's really your only option in a pediatric dental practice. You don't have to buy, I don't care if you buy the Lumina with the Neri, I don't care. If you need it for the caries or the fast scanning beam, I guess it is small, it is light. There's a lot of benefits to that. But if cost is an issue, just get the cheap refurbished one. And yes, they do sell them. And no, they're not going to offer it. You have to be very insistent and obnoxious to get it. But I'm sure they would be much happier for you to buy a used one than to buy none and not do any clear aligners. So it's the only way. I don't work for Align Technology. I've never taken a set for them. I don't even care for them as a company at all. But they're for pediatric dental, it is the best right now at the moment. And there's no way around it. So you need one. If you don't have that, you're going to have to do braces, which is not a problem. I have no problem. You can do expanders and braces all day long. I don't know how you're going to easily do your class 2 correction. You might not be able to take those kind of cases, efficiently. It's just, everything out there is just too junky, too bulky. It's not going to work for everyone. It's going to work for some patients, but fixed is not going to work for some patients. And removable is going to work for the kids that are in quicksand and they're losing their teeth, right and left. So, but yeah, I'm super happy to talk to each and every pediatric dentist. As a matter of fact, that's really what I enjoy most about orthodontics, and that's kind of the direction I'm moving my consulting in. I'm super happy to help doctors with their adult cases. It's just not interesting to me. So I really like working with the kids, and I feel like me teaching the pediatric dentists and the general dentists who want to learn pediatric dentistry, orthodontics, is the best way to help society, which is why after a lot of prayer and thoughts, I've decided to really push more in the direction to be the pediatric dental consultancy company. All right, thanks so much.